Let me introduce our distinguished panel, and I'll turn the microphone over to our first presenter. The first presenter and our first panel member is Dawn Hughes, immediately to my right, first person here on your left. Dawn serves as a policy advisor for healthcare and executive director for the Arizona Health Insurance Exchange for the Office of Governor Jan Brewer. He is responsible for policy issues regarding healthcare, behavioral health, public health, Medicaid, insurance, tort reform, and healthcare innovation for the governor. Prior to his current role in the governor's office, Mr. Hughes was special advisor for healthcare innovation in charge of planning for an Arizona health insurance exchange and other healthcare reforms. Before joining the governor's office, Don was a full-time lobbyist representing the insurance industry and other healthcare clients.
Thank you, Tim. I didn't realize we were supposed to talk about when we graduated from college and what our first job was. This is the script that Suzanne sent me as to what I'm supposed to talk about, and nowhere does it say, tell everyone when you graduated from college and how you got your first job. So I'm going to skip that part. But thank you for inviting me. I see some familiar faces. For those of you who have heard me speak before, feel free to continue eating breakfast or checking your BlackBerry. That's fine, I'm not offended by that. If I say anything wrong, Suzanne, you can talk to her about those kinds of things. I think actually what I am supposed to talk about is the governor's Medicaid plan and health insurance exchanges. The Affordable Care Act, originally, as it was enacted, required that every state expand their Medicaid eligibility to all individuals with incomes up to 133% of the federal poverty level. Arizona voters have twice voted to expand Medicaid to 100% of the federal poverty level. Right now, that's about $11,000 for an individual and around $23,000 in change for a family of four. And because of the Great Recession and the budget crisis that it caused for the state of Arizona, we received a waiver from the federal government to freeze enrollment in that Prop 204 population for childless adults. It was a very difficult decision for the governor to make, but it was one that absolutely needed to be made to get us out of the worst fiscal crisis this state has ever faced. And let me premise, again, I always feel like I need to remind people that Governor Brewer is and was opposed to the Affordable Care Act. We were one of the early states in the 26-state coalition that took that challenged the constitutionality of the Affordable Care Act all the way to the U.S. Supreme Court. We lost, for the most part. Governor Brewer also did what she could to elect Governor Romney president this past November and to help Republicans take control of the U.S. Senate so that we can move towards a more free market-oriented healthcare reform system. But President Obama was reelected and the Democrats retained control of the U.S. Senate. So when we froze enrollment in Proposition 204, it was after the Affordable Care Act had passed, and we received approval through a waiver from CMS, the Centers for Medicare and Medicaid Services. It's the federal agency that oversees the Medicaid program. And that waiver expires on December 31st, 2013, because at the time, Medicaid expansion was still mandatory. We didn't think we needed to have that waiver extend beyond that point because on January 1st, 2014, under the Affordable Care Act, as it was enacted into law, Medicaid expansion was mandatory. Well, the Supreme Court ruled that the individual mandate was both a fine and a tax and was constitutional under Congress's taxing authority. But it wasn't a tax because if it's a tax, then there's a federal law that says you can't challenge a tax until it actually goes into effect and somebody has paid it. So for that purposes, it was a fine. But then in terms of its constitutionality, under the Commerce Clause, it was unconstitutional, but the Supreme Court decided that it was constitutional under Congress's ability to impose taxes. What they went on to say was that the mandatory Medicaid expansion, which would be enforced by if a state chose not to expand Medicaid to 133% of the federal poverty level, would lose all of their Medicaid dollars for their entire program. And what the Supreme Court said was that's coercion and the federal government can't do that. They can make it optional for childless adults, for certain populations, and in the Medicaid program, there are certain categories of people like infants to 1 year to 3 years old, children, pregnant mothers, and so forth, that are required that if you're going to participate in the federal Medicaid program to get the federal dollars, you have to cover these different categories at certain levels. You can do more than that, but you have to cover at least at these levels. What the Supreme Court said was Congress can impose requirements on that portion of the program, but in terms of extending it to childless adults, that's a new category and not part of the original program, and you can't force a state to cover childless adults at the risk of losing federal dollars for all of the other programs. So expansion for children up to 133% of the federal poverty level is still mandatory. But for childless adults, states have the option of whether they want to expand their Medicaid programs or whether they don't. Arizona is unique in its Medicaid program. We were the last state to join the federal Medicaid program 30 years ago now. We were the first state to put everyone into a managed care system. We were the first state to move people into home and community-based services and out of group homes and out of nursing homes unless you absolutely need to be there. Access is the gold standard Medicaid program in the country. It is based on a public-private partnership where we leverage health plans, private sector health plans, to work with doctors and hospitals, the same doctors and hospitals that you and I see. Arizona doesn't have Medicaid doctor mills. We don't have Medicaid hospitals the way that they do in other states. So when you hear about the Medicaid system being broken, in other states, excuse me, that's true, not here. Here we run an efficient, quality Medicaid program. If you're in your doctor's office or you're here at Mercy Gilbert, the person next to you may have Blue Cross, they may have United Healthcare, or they may be on Access. We see this, they see the same doctors, the same hospitals that you do. They receive the same quality of care that everyone else does, regardless of whether your insurance is paid for through a commercial insurance company or by the Access system. So we have a good Medicaid program. And our option, because the voters in 2000 expanded Medicaid to everyone up to 100% of FPL, and because our waiver expires December 31st, it puts us in a different position than other states. If we do nothing, then when the waiver expires on December 31st, 2013, the end of this year, January 1st, 2014, the remaining childless adults that are on the Access program, we would lose federal authority and federal dollars to pay for the care for those people. So we would need to actively remove them from the Access system on January 1st, 2014. Happy New Year. Even if they're in the middle of a course of treatment. And we estimate that's going to be somewhere between 50 and 60,000 Arizona residents who are childless adults on the Access system. So that's one of the factors that went into the governor's decision to expand the Medicaid program. This was a very difficult decision for her to make. As I said, she was opposed to the Affordable Care Act. This is not the approach that she would prefer in terms of healthcare reform, but it's the law of the land. We challenged it in court and lost. We challenged President Obama in November, and we lost. Elections have consequences. So the decision that we were faced with, and what she was faced with, was, do I expand the Medicaid program, or do we do nothing and we kick 50,000 people or more off of access on January 1st, 2014? We were hopeful that CMS, that the federal government, would give us some more flexibility so that we could simply honor the will of Arizona voters and restore coverage for the Prop 204 population. In December of last year, governors received a letter from Secretary Sebelius indicating that, based upon their interpretation of the Supreme Court ruling and the law, that states could either do nothing or expand to 133. So they removed any flexibility that we were hoping for to simply restore coverage for Prop 204. Now, to expand Medicaid coverage, for us, again, Arizona is special. And because of Proposition 204, expansion for Arizona is only that population between 100% of the federal poverty limit and 133%. That's about 57,000 people that would be in that expansion population. For the first 3 years, the federal government will pay 100% of the cost for that population for Arizona. But because we were an early expansion state, and there are about 6 states that had expanded their Medicaid program beyond the federal minimums, for that Prop 204 population, instead of receiving 100% federal reimbursement for those people, we will only receive 85%, and then over 3 years, it will ratchet up to 90%. Other states will receive, for those same people, in that same income category, 100% reimbursement, while they will ratchet down to 90%. So we were penalized for being an early expansion state for doing the right thing and expanding coverage for that population. So as we were working through this, state has limited resources. The economy is doing better, but it's not doing that much better. And we've worked very hard to put Arizona on sound financial footing, and we want to be sure that we protect the taxpayers as much as possible. So to pay for both the restoration of the Prop 204 population and the expansion, the governor intends to pay for that population by allowing hospitals to impose an assessment on hospital net revenue, and then that money will generate additional federal dollars, and we'll have to raise about $154 million once fully implemented through the hospital assessment. That will draw down about $1.6 billion in federal funds, which will pay for the entire Prop 204 population, not just the expansion, but the entire population. And we move those costs off of the general fund onto the provider assessment, which will free up about $136 million of state general fund tax dollars that we can use to pay for other services such as K-12, the universities, CPS, and public safety. So we're trying to protect Arizona taxpayers as much as possible. To further protect the taxpayers and to ensure that this doesn't become a bait and switch, because the federal government, in case no one has noticed, has their own financial difficulties. We're not convinced that the federal government will live up to the promise that they have made to the states of paying higher federal reimbursement rates if we expand our Medicaid program. So what will go into the governor's plan is what she refers to as a circuit breaker, so that if the federal reimbursement rates ever fall below 80%, and again for the Prop 204 population, they're at 85%, ratcheting up to 90%, and the expansion from 100% ratcheting down to 90%. If that ever falls below 80%, then we will automatically terminate the expansion program. And at that point, legislators and whoever is governor at the time will be able to make a decision as to whether they want to continue that expansion and pay for it through general fund dollars or not. States are allowed to get into the Medicaid program whenever they want, and they are allowed to get out of the expansion whenever they want as well. That is one of the things that we do have in writing from the federal government. And I've learned that we always need to get things in writing from the federal government. The consequences of not doing this can start with January 1st, 2014, we kicked 50 to 60,000 childless adults off the Medicaid program. 240,000 people will not be able to enroll in the Medicaid program, so they'll stay uninsured. Uninsured does not mean healthy. Simply because you're uninsured doesn't mean that you don't get sick and that you don't go to the doctor or that you don't go to the hospital. You still do. You simply don't pay for the full cost of your care because it's unaffordable. And hospitals have seen their uncompensated care costs over the last 2 or 3 years virtually double during that time period. If we don't do this, uncompensated care costs will most likely double again in a shorter period of time. Those costs, hospitals, doctors have to cover their costs to keep this building open, to keep the hospital open, to provide the care for people that show up looking for care either in the emergency room, in an outpatient clinic, or a inpatient care. They simply shift those costs to private sector payers like Blue Cross, like United Healthcare, like Cigna, and those companies build that cost shift into the premiums that they charge small employers and that they charge individuals who buy individual coverage. Whether your employer is self-insured or commercially insured through a carrier, doesn't matter. They still have to pay the cost shift. That amounts, according to some studies, to as much as $2,000 as part of your family premium can be directly attributed to uncompensated care or undercompensated care. So doing this, doing the governor's Medicaid expansion plan will help address that cost shift by moving 240,000 people from uninsured into the access rolls and not kicking 50 to 60,000 people who are currently on access off of access and making them uninsured. So we think this is a cost-effective approach towards expanding Medicaid. The access program, their average costs are 12% less than the national average Medicaid costs. Arizona is not the problem in the Medicaid system. We're actually part of the solution. The other thing that I was asked to talk about was health insurance exchanges. And exchanges are basically intended to be Travelocity for health insurance. And it's intended to work on that same basic, easy-to-use principle where on Travelocity, you put in, I'm leaving from Phoenix, and I want to go to Honolulu, and I want to leave on this date and come back on this date, and I want to fly nonstop. And you click enter, and in a couple of minutes, it comes back, here are your options on US Air and Southwest Airlines, Hawaiian, and whatever your options are, and what the prices are, and you pick, and 2 or 3 minutes later, you've bought your tickets to Honolulu. The health insurance exchange is intended to work on that same principle and be as consumer-friendly and have that same first-class consumer experience as you would get on Travelocity or on any other hotel retail type of website. It is intended so that individuals and small employers can go to the exchange website and put in some basic information. If you're looking for individual coverage, they will first determine if you're eligible for Medicaid. If you are, they will send you down that path and send you over to the Access website called Healthy Arizona. And they'll determine if you're eligible for Medicaid and enroll you in the Medicaid program. If you're not, and you're looking for individual coverage, they will then determine if you're eligible for premium tax credits to help lower your insurance premium cost, and if you're eligible for any cost-sharing subsidies. On the individual side, the Tax credits are available for people who make between 100% of the federal poverty level and 400% of FPL. At 400%, that's about $92,000 for a family of four. So there are going to be a lot of people in Arizona eligible for premium tax credits. Now, if you're eligible for Medicaid, then you're not eligible for the tax credits. You can't do both. Between 133% of FPL, assuming the governor's Medicaid plan goes through, we're hopeful that it will, to 150% of FPL, the amount of the tax credit is about 97% of the premium. You would pay no more than 3% of your income towards your health insurance premium. There will be what's known as qualified health plans that will sell on the health insurance exchange. Whether it's a federal exchange or a state exchange or a partnership model, it's all intended to work on the same basic principles. You go to the website, you enter in basic information, they'll determine if you're eligible for Medicaid, if not, if you're eligible for tax credits, and then you'll go to a plan selection page and you'll see what your choices are, and you can choose between whichever insurance companies have decided to sell on the exchange. And they're hopeful that all of the big name companies and others will participate on the exchange, but we won't know that until they actually start accepting applications from insurance companies in April. Open enrollment begins October 1st, 2013. And the initial open enrollment period will last until, I think, the end of March of 2014. So the exchange is intended to work on a simple process. For small employers, you will be able to set up an account on the exchange, the federal exchange. We haven't seen a lot of details yet. You'll be able to determine how much you want to contribute towards your employees' health insurance premiums and how much choice you want to give your employees, whether you want to pick the plan as you do now, whether you want to give them more options. We're still waiting for the details from the federal government. Time is short. It's very scary as to whether they're going to be able to pull all of the computer infrastructure together on a timely basis, get the insurance companies certified and everything up and running. If for some reason you either don't have access to a computer or you simply want to talk to a live person, there'll be a call center with an 800 number that you can call and they can walk you through the process. There'll be people called navigators that will help you navigate through the system if you want to go actually talk to someone in person. We decided to defer to the federal government because we were not convinced that the federal government would be able to pull this off on the things that a state would need on a state exchange to make this successful. We're not clear where they stand on building some of the infrastructure and whether that will be ready by October 1st. And for us, it simply became too risky that everything that we would be doing would be ready on time, but we simply couldn't control what the federal government would be responsible for as to whether they would be ready on time. There are still a number of exchange-related rules that are not finalized and some that have not been issued yet. That's also pretty scary given that the timeline is open enrollment begins October 1st. And Tim, with that, I'm happy to answer any easy questions.
On our childless adult access coverage in the state, you said there was 50-something thousand people that would be bumped off if we hadn't accepted the federal expansion. And then there's going to be 200-something thousand people that will be able to receive access when we do expand. I'm a case manager and I've seen our biggest uninsured population are these childless adults. So when you're saying the 50-some thousand people that are childless adults that are on access right now, these are the ones that are extreme cases that petition that take several months to get on and they have to be very, very ill and all that. Well, they have to apply for it and be accepted and be medically cleared. So when we do expand per the Affordable Care Act, all childless adults will be eligible to get access to some type of insurance. So we should have a big reduction in the number of childless adults that will have insurance coverage. Am I correct?
Yes.
Is that understanding? Okay.
If nothing happens, and we don't do the expansion, then January 1st, 2014, we have to kick 50,000 plus people off of access who are childless adults who are on access today. If we do the expansion, first, we don't have to kick them off.
And we get 200-something thousand.
Plus, we get 240,000 people childless adults who will be able to enroll in access, who are most likely currently uninsured given their income level.
Okay.
And eligibility for access is based upon income rather than health status. So some of these people, because of their health status, are not able to get private commercial insurance, even if they could afford it. But if we do the expansion, those people will be able to enroll into access and move from uninsured to at least access Medicaid coverage.
Okay. Thank you.
On the assessments that you're going to do
Uh-huh.
in hospitals regarding this uncompensated cases.
Correct.
Are you going to allow them any grace from the charity or uncompensated cases that they're already taking care of and the impact that has on a hospital budget?
Well, enrolling another 240,000 people who are currently uninsured, those people will still be going to the hospital. You're treating them now,
Right.
and you're just simply not getting paid for it, or you're getting paid very little. Those people will be enrolled in access, and you'll be getting paid for the care at the access reimbursement rates. So your uncompensated care costs will diminish, we hope, substantially. We're talking about putting $1.6 billion of federal funds into the healthcare delivery system. And we think that will have a substantial impact on reducing the uncompensated care costs that hospitals and other providers are currently having to absorb, either through charity care or writing it off as bad debt. So we think this is a way to substantially help keep hospitals, in some cases, afloat, particularly rural and safety net hospitals that don't have the commercial business that they can shift those uncompensated care costs to, because they don't have enough mix of payers. So we think this is the best approach towards addressing the problem that hospitals are facing on uncompensated care. And the assessment is a way to pay for the state match that's required to draw down that $1.6 billion.
Hope you're right.
Well, we believe that we're right. We're still working through all the details and how the assessment is going to work. But because of the timing of the legislative session, we need to do the legislation this session. We're working on the details on the assessment on a parallel track. Whether they're going to end up at the same time or not, I don't know. But we need to move forward with this. And if you're supportive of the governor's Medicaid expansion plan, it's important that legislators hear what the impact of doing this and not doing this is on hospitals and on employers. So please contact your legislators, particularly if you're supportive, and even if you're not, talk to your legislators. I never discourage people from exercising the First Amendment rights. And then you had a question?
When you're referring to the exchanges, and we'll use your Travelocity example there. Oh, sorry. No worries.
I can hear you.
How does that work? You talked about that selection process and kind of the decision tree in the selection of the plan or the option. How does the provider assignment and or selection, so primary care provider, work into that? Is there an idea on that yet?
Yeah, the insurance companies that will be selling on the exchange, they're required to have an adequate provider network, including an adequate provider network for behavioral health and mental health, substance abuse issues, and have an adequate number of essential community providers. So they're going to have to show that they have an adequate provider network. But the exchange, whether it's a federal exchange or a state exchange, is not going to assign John Smith to Dr. Jones into that hospital. That's still a function of the insurance company. And when you sign up, let's assume that you sign up with Blue Cross, and yes, for the record, I used to represent Blue Cross. You sign up with Blue Cross through the exchange, you buy what's known as their silver tiered plan or the platinum tiered plan, you get the Blue Cross network.
So it'll be similar to as it is now, when you
Yes.
get your insurance, here's your book, here's your providers?
Yep.
Okay.
Yes. They just have to demonstrate that they have an adequate provider network.
Will there be any preference to providers who are PCMH certified or?
That will be up to the insurance company.
Okay, wait till you guys talk.
We better move us
Sure.
along. Thank you, Don.